Welcome to Health and Fitness Channel. Types of diabetes. 1. Types 1 diabetes. Type 1 diabetes occurs because the insulin-producing cells of the pancreas, called beta cells, are destroyed by the immune system. People with type 1 diabetes produce no insulin and must use insulin injections to control their blood sugar. Type 1 diabetes most commonly starts in people under the age of 20, but may occur at any age. 2. Types 2 diabetes. Unlike people with type 1 diabetes, people with type 2 diabetes produce insulin. However, the insulin their pancreas secretes is either not enough or the body is resistant to the insulin. When there isn't enough insulin or the insulin is not used as it should be, glucose can't get into the body's cells. Type 2 diabetes is the most common form of diabetes, affecting almost 18 million Americans. While most of these cases can be prevented, it remains for adults the leading cause of diabetes-related complications such as blindness, non-traumatic amputations, and chronic kidney failure requiring dialysis. Type 2 diabetes usually occurs in people over age 40 who are overweight, but can occur in people who are not overweight. Sometimes referred to as adult-onset diabetes, type 2 diabetes has started to appear more often in children because of the rise in obesity in young people. Some people can manage their type 2 diabetes by controlling their weight, watching their diet, and exercising regularly. Others may also need to take a pill that helps their body use insulin better, or take insulin injections. Often, doctors are able to detect the likelihood of type 2 diabetes before the condition actually occurs. Commonly referred to as pre-diabetes, this condition occurs when a person's blood sugar levels are higher than normal, but not high enough for a diagnosis of type 2 diabetes. 3. Gestational diabetes. Gestational diabetes is triggered by pregnancy. Hormone changes during pregnancy can affect insulin's ability to work properly. The condition occurs in approximately 4% of all pregnancies. Pregnant women who have an increased risk of developing gestational diabetes are those who are over 25 years old, are above their normal body weight before pregnancy, have a family history of diabetes, or are Hispanic, Black, Native American, or Asian. Screening for gestational diabetes is performed during pregnancy. Left untreated, gestational diabetes increases the risk of complications to both the mother and her unborn child. Usually, blood sugar levels return to normal within 6 weeks of childbirth. However, women who have had gestational diabetes have an increased risk of developing type 2 diabetes later in life. Subscribe to the channel to receive the earliest sharing as soon as I release. Kindly share this video on your social media so we can help educate others. Wishing you and your family many blessings. Discover our The Best program. Click on the link in the description. Thanks you so much.